We know we're gonna need annual physicals, we're gonna get flus, sickness, sores. It's nothing unpredictable about it. It's not a risk per se, right? So it's predictable. It is much cheaper than all of the other care that is available out there, and should be encouraged. It should be more preventative. When you make it an insurance-based transaction, it becomes a sick visit, not necessarily a health visit with your physician, because that's how our reimbursement system works. And we'll talk a little bit more about that. So this goes to show the same thing. Look, if we start using our car insurance to buy oil changes, right? What's going to happen to the car industry? What is going to happen to our car insurance premiums? They're going to go up, right? But now look at it from the mechanic standpoint. If I'm a mechanic and I have to process a claim or file a claim to get paid for changing your oil, my overhead goes up. For a transaction that is $30, $40, why should I add, $10 to $20 of overhead to just collect that? Primary care is the same way. Each transaction varies from $50 to $100. But we are making these doctors spend $20 to $30 in just processing claims and getting paid, right? The result is what? It becomes an unsustainable business model. These people have to see way more patients to keep their doors open. A mechanic is going to have to do more oil changes to keep that going, right? And that is exactly what has happened to primary care over the last several years. If you are a hospital-based primary care physician's office and you're not seeing at least 20 patients in a day, you're going to get a call from the CEO that you're not meeting your number. 20 patients in a day leaves less than 15 minutes with each patient. In fact, the average time a physician spends with the patient is about 7 minutes, right? There's no way you can do primary care that way, right? There's no way you can do preventive care that way. There's no way you can provide education to people about how to, stay healthy in those minutes. All you can do is, look, tell me what you got. Here is a prescription, or here is the specialist you can go see. It's completely ineffective. It is there just to, shuffle people here and there. Primary care is disappearing in this country. Other biggest problem is the consumer, right? So our frontline doctors are suffering. Our primary care is suffering because of how we are buying and supporting healthcare. But let's see what is happening to our patients. If you buy everything using a third party, right, you're going to stop asking what the cost of care is, right? If you're buying everything, let me give you a quick analogy, right? Let's say we go to a Macy's store, right? Two people both pick up the same shirt, but when we check it out, I am charged $50 and the other person is charged $500. Would we let that happen? No. Does it happen in healthcare?
Yes.
All the time. Why does the same thing cost, X amount here and 10X amount somewhere there? There's no even, it's not 10 times better in quality, that's for sure, right? The reason is we have completely dissociated our consumer in healthcare from the price in healthcare. So the whole concept of market is not there anymore. And if you're going to stop asking, if we're going to stop asking, look, how much does it cost? What are the people going to do who are selling those services? They're going to start inflating them, jacking their prices up. You think that's the reason healthcare's inflation has way surpassed our country's inflation in general? Absolutely, that is the reason behind it. What is happening in healthcare in some ways is our fault, right? Because we stopped caring about what it costs, stopped asking about it, and we just assume I have healthcare insurance. That's insurance company's problem. That's not my problem. I just got to pay my premium. And we shut our eyes to price. So that starts the pricing failure in our healthcare system. Right? You get what you pay for. The salaries, compensations of our physicians, our healthcare service providers are fixed by the government, right? Our frontline doctors are getting paid less. Specialists are getting paid more. Guess what our students and residents are gonna want to become? Specialists. Guess what you are gonna get as a patient? If we pay these guys more, you guys are gonna get more of these services and less of those services, right? The number of people wanting to become primary care has been in a constant decline, right? And that has a big part, reason behind it. Plus you add, 20, 25 patients that you are making them see with no satisfaction. They can't develop relationships. They don't feel like they're providing good care. They are leaving this practice. Primary care practices are being bought by hospital systems. Primary care practices are being sold, or people are just retiring and just leaving the primary care altogether. New forces not entering the primary care. It's a crisis waiting, happening basically in the primary care system, right? Is that going to drive their costs up? Well, let's see what happens when we do. So I feel like, misaligned incentives, and a lot of it is because how we pay people, and primary care is disappearing. So what happens? Let's see, right? Patient. When you talk about a healthcare system, patients, they can't be a system if there are no patients, if there's not us as consumers of health. Second thing is we need people who are providing service. Those are the only two things we need to have a healthcare system. We don't need administrators. We don't need, yes, hospitals. Well, we can build the hospitals when their first two components working well, right? But let's see what is happening to the patients now. When we need care, right, we want to see somebody, it is such a fragmented scenario, right? We see primary care whenever we can get into the office. A lot of the times we can get into the office timely. We end up in hospitals more because we never have a good primary care diagnosis. We go to the emergency rooms for problems that should be handled by a primary care doctor, right? We go to urgent cares more. Why is there a boom of urgent care centers? Exactly, right? So if there is this one problem, let's take, a UTI, right? How much is going to cost if a primary care doctor sees and takes care of the UTI? $50 to $100 to the whole system, right? Whether you pay it out of pocket, co-pay, insurance pays, eventually it is our money, right? $50 to $100. Now let's say you go to an urgent care center for the UTI. How much did that same incident cost us now? A couple $100, right? Do people go to the emergency rooms for that? Yes, they do. How much does that cost now? $1,000. That money gotta come out somewhere. If the insurance company is paying, guess what they're doing the year after? Increasing your premiums, right? Specialists. We diagnose ourselves. Internet is a good friend. Nothing bad with it. And then we say, look, let's go to a specialist. Primary care, because of the way primary care is, this is how the care has been fragmented, right? So I'm trained to be an intensivist, work in ICUs. I see in ICUs all the time, but lack of primary care is why you guys are in the ICU business. And what can I do now? Even if I get you well, you still need a primary care doctor who can then keep you outside the hospital. Otherwise, you're going to come back. So my passion is to get the primary care system sorted out, for us, for my kids. This is what we do now. And I'll tell you quickly what we do. This is our patient, right? Now we are wrapping around the primary care part of it all around you, okay? We're gonna become your quarterback, your first line of defense, your personal care team. So whenever you need us, we are there. But not only that, we bring a whole education, wellness component to it, so we are working together, right? We become a team to keep you out of the system. All these only if needed. They are unpredictable. Let's buy insurance for that. You don't need insurance for this cycle. This is a frequent thing. It is not a risk. Buy insurance for unpredictable things, right? And we will help you guide how to use these things. But have your safety circle around you. So how do we actually make that happen, right? Sounds nice though, right? If our health system works like this, we will use much less of these and much more appropriately than we are using. And if primary care is really now spending time with patients and focusing on health and wellness, we can actually, do preventive medicine in this country. And it can become a healthcare system instead of a sick care system.
Could I ask you a question?
Sure.
I have two questions. I'm a physical therapist, and so we're called ancillary healthcare. So I don't see us up there. And the other question is, my son has a mental illness. I don't see that up there either.
Absolutely. It's not meant to be all-inclusive, right? There are several portions of healthcare that go into forming a healthcare system, right? There's several portions of it. This is one example of how defragmented the care is. But yes, it needs to, all those components have to be part of our healthcare system.
And where are they? Where are they in your system? You don't deal with people that need physical therapy or people that are mentally ill?
We do, we definitely do, right?
Okay, but where are they? Where is that on your model?
They will be up here, right? You can be specialists, you can be ancillary services, right? How often does a person need physical therapy in a lifetime?
Well, it depends on if they have an injury or if they have an accident or if they have a stroke or, I don't know. I don't know the statistics.
So, yes.
But all ages, physical therapists can see people from birth to death.
Absolutely.
But what he's saying is those are crisis situations.
Crisis situations.
And he would refer you then to the appropriate person.
Right. I think, listen, there are two ways to buy healthcare. Either you pay cash or you use your insurance to do it, right? There's a lot of benefit in paying cash for services because you know what the price is and what you're paying for it. If I need physical therapy, I'm gonna call a physical therapy place and say, look, what is your price? How can we, come up with a cash deal?
Mm-hmm.
But if it is too much for me, I'm gonna look at my insurance, see how much the insurance is gonna help me pay.
What your copay is.
What your copay is and all that. But, right, what is the appropriate physical therapy? What is the progress? How long do you need it, right? You need a physician that is working with the patient to help him through all that, right? So primary care can help your life make, job much easier and more effective if that safety circle is there. The question, what I'm trying to show here is there's portions of care that are frequent and there are portions of care that are more risks. And we shouldn't be buying both of those same way that is using the insurance, right? Mm-hmm. So yes, there are several, the healthcare system is a huge, system. Mm-hmm. And I apologize for not representing physical therapy, but definitely it's an integral part of our system.
And so you would say the specialist is going to take care of the mental health needs? That would be the psychiatrist, the psychologist, that would come under specialists?
Correct.
Mm-hmm. And probably so with physical therapy.
No, they won't. They should be a separate.
Well, I would make it a separate one. Just because there's 1 out of 4 people have a mental health problem in their lifetime. Where do they go? To you?
Well, I think just for, conversation, he's just speaking in broad terms. And specialist encompasses, psychiatrists, neurologists,
I didn't.
Cancer specialists.
I didn't put labs,
Yeah.
imaging centers.
He's just speaking in general terms.
Okay.
But I totally agree with you. We need those. Mental health is a huge issue. Mm-hmm. And a lot of people, we take care of some people who have mental illnesses. Even then they need a primary care that they can contact. Right. More so in mental health issues that they can actually work with somebody closely who can understand what's going on at their home, and not just give them medicine. So I think working with the psychiatrist, if you have a family doctor, is way more effective for mental health illness, right? What we are talking about is how do you pay for it? Do you pay for it, cash out of pocket, or do you pay it using your insurance, right?
If you can add something.
Absolutely. Anyway, this is Pete. He
Hi.
works with me, and
With respect to mental health in particular, and just because it's a great example, because one of the things that is true with all primary care and health, mental health affects it all. And unfortunately, within healthcare altogether, mental health has in large part become this thing that we definitely send people to specialists. You'll have people that have a crisis and it's like, okay, you can see your therapist, you can get in to see the psychiatrist in 3 months. Well, when you're having a mental crisis now, 3 months is not very effective. There's a huge portion of mental health that can be very effectively managed on the primary care level. The problem with mental health is it takes time, it takes dialogue, and it takes getting to know the patient. And the system is not set up for time, dialogue, and getting to know the patient. And part of being a really good primary care provider is being able to work with those specialists when, just being able to accurately help assess somebody, help figure out whether they can be helped at a primary care level, whether they can be initiated into mental health care, help them stabilize in the process of getting them to what oftentimes is a 2 and 3 month wait to get in to see that specialist for the first time. And then to be able to help continue that care in conjunction and have those conversations with the specialist. That's the kind of the beauty of our system, is it does give us that time and that freedom to actually have those relationships with your specialist, as well as you, to be able just to help be better overall manage the care process.
So do you have like 5 doctors in your network that are psychiatrists that deal with mental illness? Or, because, my son goes monthly to the psychiatrist and says, how's the medication working? Okay, not so great, or it's fine. So, first of all, can you prescribe antipsychotic medication?
correct. You don't have to have a psychiatry degree, you just need a doctor's degree. You can prescribe antipsychotics, yes.
So you go to school and you're familiar with side effects and what to change, and what to add.
Not as
how
good
to
as
put
a
in-
specialist, not as good as a psychiatrist, but when you train for primary care, yes, you do get some psychiatry training.
Okay, well, my son is 33, has tried 31 different medications and none of them are working right now. So, I don't know who's gonna pull the next one out of the hat for him to try, but,
Yeah.
I don't know if that would be you or if that would be his psychiatrist. I mean,
I think we should probably sit down and really talk one-to-one, and we will definitely try our best to, solve some of those pain points for you. I want to quickly talk about quadruple aim. So most of our health industry is trying to achieve this quadruple aim. They used to be triple aim, now it has become quadruple aim. So what the triple aim initially was, that look, whatever we do in healthcare has to focus on these 3 things. It has to improve our patient's experience, improve health outcomes, or improve the health of our population, and lower costs. Guess what they realized? If our physicians, our nurses are burning out of the system, you can't do any of this. So they added a 4th one, improve the healthcare team experience, right? So they don't leave the system, they stay in the system. Our model, the direct primary care, so it's called direct primary care, where the primary care is delivered directly to the people buying healthcare. There's no third party in here. The direct primary care movement hits all these points. Doctors are happier, and I'll show you why. Patients are happier. Healthy outcomes, more appropriate care, and the cost is lower because now you're not spending $200 to $1,000 for UTI, but a primary care is taking care of all those issues.
Would a system like this qualify as having insurance coverage for your IRS purposes?
Yeah, we will get into that in a little bit. But
That's big.
Answer is no, right? Why is this? Because the insurance, what IRS or what Affordable Care Act mandated was everybody needs to have a certain amount of coverages for able to qualify as having health insurance. And most of that is preventive care services, right? And that includes colonoscopies, mammograms, DEXA scans, right? Your annual physicals, your lab works and stuff. So all that needs to be part of a health plan for it to qualify as a qualified health plan that you can buy and get out of the manual. So my primary care doesn't meet all those requirements, right? So you do need a catastrophic wraparound policy or a supplemental policy to meet those mandates, right? Well, how we do that, I'm gonna, get into that in a little bit more. Yes, sir.
As an entrepreneur, single owner business, Affordable Care Act allows you to deduct all that preventable care 100%.
Correct.
It's a totally different world if you're just an individual versus a business.
Correct. I mean, and even if you are an individual and you have health savings accounts and stuff, you can still, do a lot of it free tax dollars.
The stuff that Medicare doesn't cover, everything, and you go down and buy vitamin C, it's deductible according to the Affordable Care Act if you are a business, small one-person, two-person business. It's totally unknown to most people.
Really?
Yes.
Thank you. But don't you have to have an HSA in order to be able to do
So, but who is buying it? Is it the employees buying it or are you buying it for them?
No, we're talking about deductibility. Doesn't matter where the cost comes. If you're paying it out of your pocket and it's not deductible under your current, whatever program it is, doesn't meet the level, it's still deductible as a business expense, not as a health care expense.
Right.
It's a different world. But again, it applies only to small business, mom and pop shops, individual solopreneurs. It's specifically written into the Affordable Care Act for that.
Great information. That is
Awesome.
Yeah.
So check with your CPA, because that's been around now, it's 3 or 4 years. So
Okay.
Who signed that into law? Who put that into law?
was part,
3 or 4 years ago.
part of the Affordable Care Act.
part of the Affordable Care Act.
Part of, but
It's a
business
subsection
owners.
of the Affordable Care Act.
I want to show you guys the video to just kind of quickly explain what this is. A different company out of Pennsylvania that is doing something similar to what we are doing. Okay? And just this is a nice video that explains.
Whenever I went to the doctor's office, I spent ages in the waiting room. And by the time I finally saw a doctor, well, he was hardly even there. Then I found out about our health. They do this thing called direct primary care, which means that instead of dealing with insurance companies, I get direct, unlimited access to my doctor for a flat monthly fee. And my buddy John, he just got offered our health through his work benefits. I've still got basic insurance for the big stuff, but for everything else, I use our health. These days, I hardly even see the waiting room. My our health doctor actually listens, and we take as much time as we need. I can even send him an email or set up an appointment over Skype. I sure don't miss the old days. With our health, I'm in control. For more info, give us a call or visit us online at ourhealthconnect.com.
Okay. So that was them.
When I used to get sick, I would turn to the first place I could.
Sorry about that. Okay. So I'm going to talk a little bit about direct primary care and why it is, essential that we move to this model for us to, meet the quadruple, right? So I'm a direct primary care guy, right? I started my practice from scratch. I do not have any billing claims people in my office. Only people in my office are there to actually provide care, right? Nobody is doing anything useless as far as patient care goes. So it's me, Pete is there, he's a nurse practitioner, and Karina is there. She's an office manager, she's also a phlebotomist, and she also has a nutrition degree. Pete has an exercise physiology degree, right? So we are a nice team, and we all are involved in taking care of our patients. How do we get paid? We get paid on a monthly membership-based system, right? Why did we move to that model? Once you put your credit card, debit card on file, we charge it like a gym charges your membership, right? We don't worry about any co-pays. There's no co-pays, right? There is no extra charge when you use us. Money part of it is already taken care of, right? All I focus on now is how to provide you good quality service, good value service. Incentives align the same way. Now you are in mind, and I'll tell you what, who's the best customer for a gym? Any guesses?
Someone
Someone who never shows up, right? How can I get there? As a health clinic,
Keep everyone healthy.
keeping everyone healthy. Thank you, right? So do my incentives align on the same side as your incentives? You are paying me to stay healthy, and my job is not to keep you healthy. Now we are aligned the same way. Let's look at the traditional model. How do they get paid? When you get sick. Right? Are we incentivizing them to keep you healthy then? That's why that's a sick care system and this is a healthcare system, right? I have low overhead. I'm not worried about my reimbursements. I know what I'm gonna make, how much I'm gonna make, and when it's gonna come. That's financial viability in my model, right? Sustainability. Look at what's happening to my practice. 500 to 800 patient panels is our goal. We're gonna see maximum 10 to 12 appointments per day, and that includes telemedicine visits, not only in-person visits, okay? Compare this to the traditional practice. Patient panels are 2,500 to 3,500 there. Average number of appointments is 23 nationally. This is study done, right? 23 patients, a single primary care sees one day. Now again, how am I keeping you guys? Go ahead, please.
Sorry, 500 to 800 patient panels, what does that mean?
That means that, like, if I'm a single gym owner, right? I need 500 members to be paying me on a monthly
okay.
basis for me to, survive.
So you're looking to have 500 patients
Correct,
pay every month?
every month. That's our, as a business model, it makes perfect sense to get 500 to 800 members.
Yeah,
right?
okay, thank you.
Which is much better than what the traditional primary cares have been, forced to do because of how we, pay and buy it or sell and buy it. Patients. Now concierge becomes automatically, a part of it because I'm dealing with much less numbers, much less administration. Now I'm bringing telemedicine into it. I can take care of you over the phone. If you have a flu, right, and you want to be seen by the doctor, do you really need to come to the office all the time? You don't. If I know you well, we have met before, we can talk through video chat and you should stay home. There's no point coming to our office.
And infecting other people.
Yeah.
Now, let's say that flu starts becoming something else, and it's not getting better. How hard it is to get a hold of us? We just a text message away. Not getting better, we can get on the phone and then change the course if we need to on a timely manner. Now you're not waiting 30 minutes, an hour or something to get advice from a doctor about it. So it's better care. Otherwise, they're giving antibiotics to everybody when it's not needed, right? So it's better care as well. No co-pays, no deductibles. It simplifies life for you. You are paying on a monthly membership. See, most of what you need in a lifetime, and again, this is data, 70 to 80% of healthcare you're gonna need can be met by your primary care doctor, right? So now you have capped all that care into one flat monthly fee with no complications, no administration, nothing. And you're using the insurance for the rest of the time.
So, you might have covered this when I said that, but lab,
I'm gonna go to that, and that's where we're going. I haven't covered it yet, right? So I wanna show you guys two documents. You guys all have that. we have a pricing sheet, right? And then even when, can I see this? I prepared a small questionnaire, right?
Did everybody get one?
There we have,
He's already turned it in.
No, this one.
Oh.
No, I'm gonna go to that one too. I was gonna, see, does your doctor help you price shop when you need lab work, imaging, or specialists? Never, right? That's a novel
Most of
concept.
the time, they don't even know how much it costs.
They don't know. I didn't know
They
before.
don't have a clue.
When I trained, I had no idea how much these things cost.
They're cheap.
They are so cheap, right? Now, if your annual lab work, if I do like a whole panel, your blood counts, your chemistry, your liver, your kidneys, your cholesterol, your vitamin D levels, total cost about 30 to 35 bucks. Pay cash. You know who is giving me these prices? Quest, LabCorp, CPL, doesn't matter who the lab work is. They are their prices, they're not my prices, right? We don't make anything off of it. We are just connecting all the healthcare service providers and goods providers to our patients. Our only way we make money is your membership, right? But now what we are helping you do is become a smarter consumer. Realize how much these things actually cost. And if it is 20, 30 bucks, it doesn't make sense to use insurance. There is no need to add that whole big administration cost to it. Pay for it cash. Our members use their health savings account, it's tax deductible, 20, 30 bucks, buy it cash, and you're done. How many times are you gonna need lab work? Diabetics need it every 3 months. A1C that you need checked. Cost of A1C is less than $10. Even if you do it 4 times a year, it's 40 bucks. If you buy these same labs through your insurance carrier, you're gonna pay several $100. Everybody has a big deductible now. They're not gonna pay, they're gonna pass the bill to you, and for the same lab work, you're gonna pay 10 to even 40 times higher sometimes. That's cheating, okay? They are blatantly cheating us, because the actual cost is very, very, very low, right? So what we do to answer your question about labs and imaging and stuff, we help you price shop. We look at your insurance plan if you have one. We see how much it's gonna cost you, how much your deductible is. Is it better to use your insurance or is it better to buy cash? Give you a quick example. One of our members has a $5,000 deductible insurance policy. Needs an MRI brain. He goes, shows his insurance card. They wanted him to pay $4,200 out of pocket before they would do the MRI brain, right?
With insurance.
With insurance.
Well, that's to meet its deductible.
Yes, just because it's $5,000 deductible, right? Even if he didn't have the deductible, if he had a $500 deductible, guess who's paying that money? The insurance company. And where is the insurance company collecting that money from? All of us. So why buy something that costs $400 for $4,000, right? The whole system has been turned upside down because we stopped asking for.
so how much did the MRI cost him actually?
$350. Actually, there was a sale going on, it cost him $275. Saved
Down from
him
4,200.
Saved him thousands of dollars right there, right? And that happens in everything. Medications. Crestor is one, does everybody know what Crestor is? It's a cholesterol lowering drug, doesn't have a generic, costs a few $100 even if you have insurance. Does it really have that much of benefit over the generic Lipitor? No. We have 4 or 5 patients already that were just making that simple switch from Crestor to Lipitor, save them hundreds of dollars every month. But did their doctor ever take the time to look into that and do that? No, they don't. We do, because my job is to save you money. If I save you money, you're gonna buy my membership, right? I'm working for you now, not for anybody else. You have a question?
Well, yeah, do you, like, if you get one of these blood works, do you draw the blood or do we go to
We do
the
that, we
lab?
draw the blood.
Oh, you do? Oh, okay.
We can draw either way is fine. If there is a Quest next to your house,
Right.
and you need a fasting blood work in the morning, you can drop by there and get it done.
Okay.
And we get the results.
Okay.
So that's the point of my pricing chart. Look, care is not that expensive. We have been led to believe that it is expensive. Okay? And if we at least start looking at things, how much, these cost, we're gonna end up paying much less for things. You need a family doctor guiding you through all those processes though, right? And the family doctor needs time to be able to do that. So our whole premise of what we do is we kind of put time back into a patient-doctor relationship, right? And remove the barriers when you communicate with them. That's why we have a mobile app that we use for texting. It's a HIPAA-compliant, secure app. A lot of our members text us for stuff. If they need an appointment, all you need is a text message, right? You want to come in for blood work, all you got to do is send us a text message. You want us to give you a call back, text message. It's as easy. Nothing, holding the phone and home. Now, how do we, so my service is a primary care. It doesn't cover the insurance. You still need insurance for big stuff and to get out of the penalty. First, let me say, does anybody know what the penalty is this year?
Penalty for what?
For not having insurance.
$2,000 is what mine was.
So it's 2.5% of what you make, or $695. So you're right. Whichever one is the higher one, right?
Naturally. We want the money.
You want the money, right? So if your 2.5% is $3,000, that's your $3,000 penalty. Cost to our membership for one person is $1,000, right? Does it get you out of the penalty? No. How can I get you out of the penalty? There are two ways to do it. Buy a high deductible health plan so you're paying less in premiums and more keeping it in your pocket, okay? And have a health savings account attached to it, okay? The second way is, and that's one I want you to go to the second sheet that is here. It's called Liberty Direct. So Liberty Direct is a health share ministry. Has anybody ever heard of health share ministries? No. Russ has, because I told you. So health share ministries, they have been present for 3-4 decades. Their growth has been pretty rapid since the passage of Affordable Care Act. Since the premiums have been climbing up, people have been leaving the traditional insurance industry in masses and joining programs like health share ministries. Okay?
Are you saying ministry?
Ministries, yeah. Or
Yeah, they advertise on the radio periodically too.
yes, they do. So let me borrow this quickly, and I want to walk you guys through something. Okay? So how does health share ministry work, right? Let's say 1,000 of us come together, right? And decide to start pulling money into an account. And then whenever anybody of that 1,000 has a healthcare need that is catastrophic, we pay those claims from that pool. So it's kind of like self-insurance in a group, right? There's not a whole lot of administration attached to it. There's not CFOs, CEOs making millions of dollars of salary out of that. It's very small administrative costs attached to that. That's how these healthcare ministries work. You become part of the ministry and you share a monthly amount with all the members, right? And that becomes your insurance policy, okay? Liberty.
Catastrophic insurance.
Absolutely. So let's look at what the costs are. And this will get you out of the mandate. Once you are part of this ministry, you will not be paying penalties. Okay? That's clearly written in the Affordable Care Act. So if you are an individual, let's say, over 30, assuming everybody's over 30
How
in this
about,
room.
okay, does this apply to Medicare patients too, like over 65, or are you just talking about between the?
Medicare is an approved one. You don't worry about the mandate with Medicare.
I mean, Medicare is insurance, so if you have Medicare, you don't have to worry about the mandate. But if you are Medicare and you don't want Medicare, you want to buy into this, you're free to do that. So let's look at, the first line, individual. Your monthly share is $199, right? Does everybody see that? Annual unshared amount is $500. So what does that mean? That means that whenever you incur health expenses, first 500 over a period of year is gonna be out of your pocket. Sounds like a deductible, right? They don't call it a deductible because they're not an insurance company. They call it an annual unshared amount. So your monthly cost is $199 and your yearly deductible is $500. Now, what these guys realized were that if I don't really have a good direct primary care for my people, the money that I'm putting in an account is gonna dry up quickly. So let's provide everybody good primary care so they're using less ERs, less urgent cares, more appropriate care so we keep our costs down. So out of that $199, $60 they're gonna pay to a provider like me. That's why they're called Liberty Direct, okay? Per month for you, okay? Anybody who works in my model, there are about 1,000 of us in the country right now. It's a growing movement, okay? There are about 4 in Houston. So you can become a part of this Liberty Direct and get $60 paid to the membership monthly from Liberty directly to the physician.
So 60 of the 199 is paid to you.
Correct.
Cool. And then we're in, or
And
do we
you're-
pay more?
So that depends on the price of the primary care doctor, right? Let's see, let me tell you what I mean by that, right? My membership fee is $99 for the first person per month and $49 for the second person, that is partner, spouse, girlfriend, boyfriend, you know, and then $9.99 for the kids per month, right? I set my prices and I want to prove to you guys that it's valuable, right? The government hasn't set those prices. I have set those prices, right? There's another primary care doctor who operates on the same way. And he comes in and he sets prices, 30% lower than my prices. Now, if you are a consumer, how are you gonna determine who to pay?
Lowest price.
Or services, quality. Yeah.
Assuming equal service, yes.
Assuming equal services, but we know it's not the case, right?
We don't know.
So now, how are the doctors competing? How are we competing? We are competing on price and quality. Is that good for the consumers?
Yes.
Absolutely. In healthcare, that doesn't happen. In every other industry, it happens. Imagine Apple and T-Mobile have to sell their phones at the same price. You think that's gonna work? No.
No.
It's price and quality. Why do we pay for Apple more? Quality, right? So what Liberty Direct did was, I don't want to fix you guys' prices. I'm just going to contribute $60 towards your membership. And if you are charging $100, let the member pay the rest $40. Keep the member in the skin, keep me on the hook for proving that I'm valuable for that extra $40, right? But if you find somebody at $75, then your monthly amount is only $15, right?
What's the youngest patient age-wise that you see?
I have a 32-year-old. I do have a lot of kids. The youngest kid we have is 11 years old.
So 11 through the elderly?
Yes. Yeah.
And
We
what
do
would you
have
say your
about-
percentage of
So
geriatric
if
ones?
someone didn't want to do the Liberty Direct monthly share annual uninsured amount, they would pay you $99 a month.
Correct. Correct. So why I say this is, I'll give you guys my example, right? I've been buying Blue Cross Blue Shield, right? I've been independently working, self-employed. I had to buy my own health insurance, and that's when my eyes started opening to this whole world. Because up until that point, my employer was paying for it, and I was oblivious to what's going on, right? I pay $1,100 a month for Blue Cross Blue Shield policy for a family of 4. Wife, two little girls, right? My family deductible, $13,000, right?
Crazy.
Crazy. Can I find a cheaper policy? I can't even find one, even if I tried. I stretch the deductible as high as they go. They can't even go any higher than that, right? So that is something I have to pay to get out of the penalty and provide some kind of risk coverage to my family. Am I buying that for primary care? Hell no. I don't use insurance to buy primary care. I go pay them cash because I know if they bill my insurance, I'm gonna get the bill. It's probably gonna be 3-4 times higher than that. So I have that policy and I'm not even using it, right? Then I move to Liberty Direct. $450 is my monthly cost, right? And we have $100 as a family pay to a primary care doctor already. No copays, nothing, easy access. Life is much simpler. Life is much cheaper. Now, what happens is, my daughter, for example, these tonsillectomy, she needs tonsils taken out, right? So how am I gonna use these guys? I call the doctor, I said, look, how much you gonna give me? Give me a bundled price. Bundled price means, give me what you're gonna charge, give me what the anesthesia gonna charge, give me what the hospital gonna charge. We don't do that. They're all gonna bill you separately. I said, fine. Tell me, it doesn't happen in any other industry, by the way. If you go buy a truck, you don't buy cars, tires and seats and everything separately, you buy the whole thing, right? I said, fine, give me 3 separate prices then. I got the 3 separate prices, we negotiated, we're gonna pay in cash. But then I turn it to the ministry, and anything above $1,500, the ministry will reimburse me. Okay.
Wow.
Does the whole healthcare system save money that way? Yes, because now I have negotiated a cash price, which is much more transparent. I know what I'm gonna, go in. I'm gonna pay it, and I'm gonna get reimbursed. Does Liberty Direct like that? They love it. They love the consumer who will negotiate a price before he pays for it and blindly going into it. Right?
How much did you negotiate down, like 20%, 40%?
I'm still negotiating down, but I just had birth of my daughter is now 3 months old. Right? So I did the same thing for our delivery, normal vaginal delivery at Memorial Hermann Medical Center. Through insurance, my out-of-network deductible was about $15,000, and I probably would have had a bill of about $15,000 or even more, right? I negotiated, and total cost to me was about $5,500. $3,200 went to Memorial Hermann Hospital for 2-night stay, including all the lab work, and that was a negotiated price. $1,100 went to the OB-GYN guys, and about $1,100 went to, the pediatrician and the anesthesia, right? $5,500 or so. So these are all cash prices. I paid with my health savings account, and I'm gonna get reimbursed, right? So there's a better way to do it.
So you've dropped your insurance, you're just doing this.
I'm just doing this, right? This is my insurance. I'm out of the penalty now, right? I'm not gonna pay penalty. There's no point of me having that insurance when I have this.
So if you need to go to, say, a podiatrist, who would you go to that would accept this insurance?
This is not an insurance,
Oh,
right?
Okay.
This is the beautiful part about it,
Okay.
that now there are no networks.
So you would then find a doctor who will take cash and you would pay them directly.
And get reimbursed.
Okay.
So now the whole networks concept is gone. Networks concept is one of the,
Most difficult.
ugliest things in health.
It is.
It is very.
Try
The racket.
Medicare,
Yeah.
try Medicare.
It is a racket.
Yeah.
It is a racket.
Yeah.
And if you understand how the PPO discounts and everything work, it's a complete racket. Our goal with our way health is to eliminate networks.
All right, I've got a question. Now, question number 1, do you deal very much in geriatric clients?
We are starting to see geriatrics, geriatricians, right, also need to get into doing primary care this way. And I feel like our geriatric population is the one who needs this kind of model.
Let me give you a scenario. I'm in assisted living. We have geriatric doctors that come into the community to care for the residents and their nurse practitioners. I often get somebody that comes into the community that's on some linkage plan, some HMO that's linked with Medicare, and they have to use that network. and I can't get them off of it. So that they can't use our doctor. What do we do?
It's painful. So here's what I am trying to do. There is a company called Graceful Living, and they're a new company, and they're gonna be building, 55 plus homes, basically. And the whole concept being, like you just said, look, let's keep you guys healthy, home, and whatever. We're gonna build doctors' offices in the communities. So those doctors are gonna be exclusively responsible as their primary care doctors for the residents living on their premises. So that will be your concierge doctor.
When are they coming?
Wow, awesome.
Yes, that's like Del Webb, like a Del Webb thing? Like Del Webb, is that what you're talking about, 55 plus homes?
Yes. And so, something like that, but bring the concierge direct primary care model to people instead of them coming. Huge transportation. If I can just save you a trip to a primary care doctor,
Yeah, when you're a geriatric client in an assisted living community, and you have so many comorbidities, you can't get to a doctor.
And you don't need me.
And it's too hard. It's just too.
if you have good primary care doctor, I guarantee you don't even need that many specialists.
Yeah, right.
You know?
So let's take this person that has this linkage plan, yeah.
Mhm.
If we can get them off the linkage plan, they have Medicare primary. How would this benefit them?
This kind of model.
Mhm.
So here is the thing with Medicare, right? Medicare, as a physician, Medicare makes my life pretty hard.
I'm not laughing about that.
So they don't want me to take cash from Medicare patients.
That's right.
Right? A lot of people are doing it. How they do it? MDVIP. MDVIP is a big company,
That's story.
right? There's a lot of MDVIP docs in Houston. They are traditional concierge doctors. What they do is they charge access fee. For the health services provided, they still are billing the Medicare, right? They don't reduce the cost of care that way. In some ways they do, but at least for that encounter, they are still billing the Medicare people, so there's still that administration cost, but they now charge access fee. And what they charge access fee for is non-billable Medicare services, they call it. And they charge a monthly or a yearly access fee to provide concierge level access, phone access, and stuff like that. And they continue to bill Medicare, right? That's something I don't want to do. I don't want to label it access fee and care fee differently. I want it to be all care, right? But Medicare doesn't agree with me on that, right? They will though. They are listening. There's a lot of things going on at the legislative level where this model, Medicare is actually doing a pilot to try something like a membership-based system for our seniors, so primary care can become, more timely basically. So Medicare is a challenge. If we have to, then we basically have to do it the access way. Look, this isn't, I'm charging you monthly membership. I'm not even gonna bill Medicare, but this is purely for access to me, not the care provided, and you have to promise me that whatever you pay me, you won't file for reimbursement to Medicare. So we have to do all that for Medicare to happen.
This Liberty Mutual,
Or
would that be
Liberty Direct.
something? Liberty Direct. Liberty Direct, whatever.
Liberty doesn't choose providers for you,
Right.
right? It doesn't say, look, you gotta go here, or gotta go there. All they want you to is stay healthy, take care of yourself, and help all the other members, right?
Well, if somebody had Medicare primary,
Mhm.
would it be a benefit to them to also be involved in Liberty?
The benefit, see, I think as far as the cost goes, right? Medicare still is the cheapest insurance out there, right?
Right, but you need a supplement.
Supplement for buying, I guess, the question is, what are you trying to get? Are you trying to get good quality primary care? And if the question is, how do you get good quality primary care, we're gonna have to do, those 2-3 documents that I talked about and bring you guys concierge services. Even if you do Liberty Direct or something like that, you still have to, as a physician, I still have to, satisfy Medicare that, look, This is purely access fee, not for the care provided, and you won't reimburse or offer reimbursement for Medicare. So it doesn't matter how you pay the concierge doctor, whether through Liberty or through. But as somebody who, the other way is opt out of Medicare. Right? If I, as a physician, totally opt out of Medicare, then I'm free to do whatever. I don't want to do that. I want to stay in Medicare, and I want to figure out a way to take care of Medicare patients eventually. Right? So Medicare is tricky, but if there are patients who need our services, we will make
So
it
with
happen.
Liberty Mutual, right, they connect with you,
About 25 minutes.
so they don't connect with other doctors.
They don't connect with doctors who are doing a fee for services, right? They connect with, they have, hundreds of doctors on their panel that they are directly paying on a monthly basis.
You've got to understand that there are two different kinds of Medicare. There's the traditional Medicare, and then there's the Medicare Advantage.
Right.
And they don't
Those
work.
linkage, no, they're,
They're totally different. Absolutely.
Yeah. And there are actually, there's a company called Iora Health. Iora Health is, again, one of the pioneers in this kind of primary care model. And they are working directly with a lot of Medicare Advantage plans to change the delivery of primary care to this model. So sooner or later, all primary care is going to be this way. It's not going to be the traditional way of doing things, right? That's
well, I know it's over the last number of years, Medicare is trying to push it, everybody over 65 into these Medicare Advantage plans. There's been a lot of push. And it's a real problem for a lot of people that are in it.
Russ, you had something?
Well, I was just gonna say, it's getting close to 1 o'clock. I know people.
Thank you for what you're doing.
I hope it was useful.
Fabulous.
Yeah.
Yeah.
See you, Peggy.
Bye, Peggy.
Bye.
I just wanted to make sure that if anybody else had any other questions, or they had to leave, I'm sure that you'll be available to answer questions. And if anybody had to rush out to another appointment, I just wanted to make sure we were, considerate of your time.
But I do hope that you guys will give us an opportunity to be your family doctors and show you guys what we can do. We don't have any contracts. We're not like AT&T will buy you a 2-year contract. It's a month-to-month deal. $99 or Liberty Direct, even less. Free to cancel anytime. We want you there if you're happy. If you're not happy, please let us know how we can make you happy, but there's no contracts.
I want to share a personal testimonial. I was in Arizona.
You go up, Fred.
Yeah. I was, I just had to.
Marion is his mother.
I was in Arizona visiting my folks, and I ended up waking up at 1 o'clock in the morning. All of a sudden, I had chest pain, shortness of breath, and having been a former EMT, I'm going, this is not good. So essentially, 5:30 in the morning, I said, hey, I think I need to go to the ER and get checked out, my blood pressure or whatever. And so I got there, checked in, they immediately took me in, started giving me drugs and taking tests and everything else. Dr. Goyal sent me a text and he says, hey, call me. I don't know if and I was shocked, first of all, because I've never had my doctor call me or text me or reach out to me at any point in time. And fortunately, he reaches out to me, and then after I got out of the hospital, he follows up and he calls me to check in and scold me for not calling him earlier.
That's our mentality, right? Like, we don't think that our primary care is going to respond now. I'm just going to go do whatever I need to do.
Right.
So I hear about him in the hospital from Marion. And so then he'd been in there for 2-3 days. I said, look, why don't you at least let me know that, at least I can guide you and stuff.
Right.
And we did that one of our other members. He actually was having a heart attack, calls me at 8 p.m. That, look, I'm not feeling well. I sent him to the emergency room. But we guided him through each step of the way, almost till, 2-3 a.m. It doesn't happen every night. It's happened only once every 6 months. Last 6 months. But just him having us there as a team, telling him, look, these are the blood works you're looking for. Take a picture of the monitor so I know what your vital signs are. This is what you can expect from the cardiologist if he comes, right? Then he walks out with 2 stents in the heart. We know what medications he's leaving, you know. Is he making sure they're ready for him to be picked up, started? Cost, we looked at the cost. Are these all, you know, the cheapest ones and the best ones? And they were not. There was the same Crestor issue. They put him on Crestor, said, no, take it out. Let's start Lipitor, right? So all that in 24 hours or 48 hours we were able to do with it for him, it can't happen in a traditional system, right? You're not going to get that. But we need that. I feel good about that, and he feels good about that.
Well, now when you go to the hospital too, you end up with a hospitalist that doesn't know you from Adam, and you'll never see you.
I never actually saw a doctor.
And you won't.
I never actually saw a doctor while I was in the hospital.
What?
Wow.
No, I saw a physician's assistant, nurse practitioners, and I saw some other people I don't know.
But you don't see the doctor.
Some random people came in.
You know, hospitalists, right? Yes. My wife is a hospitalist.
It's a doctor that just only works from the hospital.
Yeah, so it's kind of like a primary doctor in the hospital.
It's a new thing.
So why is it a new thing? Because initially what was happening was, if you are my patient, I would even go to the hospital and see you, right?
That's right.
Right? That is impossible to do.
Anymore.
Yeah, because you have to see.
At one time you could do that.
One time you could do that, but that was also the time these guys were working 24/7 a lot of the times, right? It's hard to do. Thank you for coming. So how we operate is we talk to the hospitalists. We talk to them, say, look, our patient has to be admitted, he's coming. Let me tell you what's going on. This is what needs to be, you know, this is what we know, this is what we're worried about. You know, this is a specialist you may want to consider, blah, blah, blah. And we did that for, you know, one patient that, you know, got admitted. We didn't send him to the emergency room because he wasn't having a heart attack. It was a more, you know, got him directly admitted to the hospital, talked to the hospitalist, everything was streamlined. Right? And that's what I mean, you know, when you have this full circle of primary care around you, he's not just your family doctor, he's your coach, he's your health navigator, he's your health advocate, everything is in that. Right? It's so important, especially when you're dealing with a big system.
So the hospital is, open to this?
They were very open, you know, because it makes their life so much
Right,
easier.
that's what I'm
Well,
saying.
yeah, but sometimes, you know, there's lines and it's defensive.
They do, I mean, yes, you know, you have to do with personalities pretty much in every industry, so, but they like it.
Well, it's kind of like being a discharge planner or a case manager in a hospital. The more information you can gather about family dynamics or what's going on, because again, like your wife, she just sees that person in the bed. She has no idea, you know, that she has a special needs son at home or something like that that is affecting, you know, her health.
Absolutely.
And so I can see that a hospitalist especially would be
They're very
so
appreciative.
helpful. Yeah.
And they like it. They know that they're doing a good job. They know, see, what Medicare started doing was, Medicare started penalizing these guys if their patients were getting re-hospitalized within 30 days.
And that they penalize the hospitals.
They penalize the hospitals and the hospitalists, right?
Are these family practice physicians?
No, hospitals are.
They are usually internists.
Okay.
They're usually internal medicine. So hospitalists love something like what we are doing because they know that their transition to outside is going to be smooth. These people are not going to be bouncing back to the hospital. That means more money for them or less penalties for them and the hospital.
So do you have admitting,
I do.
okay, like where, all over Houston or the medical center, or how does that work?
You know, I don't need admitting privileges
Okay.
to practice medicine outside the hospitals.
I know.
But
Right.
I do have them because I still do some hospital work to maintain my critical care training skills. So I work at Methodist Medical Center and I work at Memorial City, Memorial Hermann, and I have a couple of LTACs that I'm credentialed at. It's a pain in the back to get credentialed at hospitals, so it takes a long time. You got a question, Megan?
No, I have a testimonial.
Oh. Please,
I just can't hold it in. So, you know, I gotta tell you guys.
Don't hold it back.
Yeah.
Don't hold it back, Mary.
So as I'm getting older, I'm sitting in front of a computer longer, I'm getting bigger and bigger and bigger, and no one seems to be able to help me. So I came into Dr. Goyal's family. That's really how I feel about it. And I didn't just see Dr. Goyal, but I started talking to Peter. I mean, we're talking about hours of care, emails back and forth, sending me information about my health and what I could do to increase my exercise. And Peter, I just want to really hone in on Peter right now. He went out of his way to find anti-inflammatory foods for me, a whole list. Like I was eating a banana a day thinking it was wonderful for me. Who knew that might be some of the problems that's causing pain in my body? I didn't know that. But by talking with them and getting to know them as, you know, my team, it's just changed my life and how I'm going forward. So thank you guys, I really appreciate it.
Well, thank you, Mary. But, you know, I think
I have more, but I won't drag you into that.
it's critical that the approach to healthcare is kind of more based on foundations of, you know, nutrition, how you sleep, how much you exercise, those things, and not on, you know, medicine. Right?
Right.
And again, that's where a good family doctor comes into play. If he's not teaching you about those three foundations, we call them, he cannot do a good job. You know, you can't really see the wellness side of things. So our approach, it really is based on those three things first, and then everything afterwards.
I had a quick question. Do you recommend supplements or?
There are certain supplements we recommend. You know, not everything that is out there. There are certain supplements we recommend. And, to give you one example, for people who are on statins, I feel like should be on cobalamin, you know, CoQ10. So there's certain.
Are there differences between different CoQ10s? I've heard that some of them are not as good as others.
I'm not aware of that. Are you aware of anything?
No, but I think unfortunately, like a lot of things, CoQ10 is not controlled. So it's just like me giving you Centrum versus another multivitamin. One may be completely reflective and you get nothing out of it. The other one, you know, are they actually doing their due diligence and worried about enantiomers of chemicals and this and that and the other thing? But that's unfortunately, and that's what we would tell anybody is supplements can be wonderful, but there's no predictability. You can't count on whatever's going in your mouth is exactly what you think is going in your mouth from a dosing standpoint to a lot of other things. So there's a little bit of, you know, you have to understand that going in.
Unless you know the production.
The source.
Yeah.
Sure.
We do use a lot of, not a lot, but some compounding pharmacies that we have relationships with, and they will give us, again, cash prices that are much cheaper than retail prices. Especially when it comes to men's health, and even women's health, like hormones and stuff, which they, you know, we can tailor them and get you guys good prices for those that you get. I want to quickly say thank you to, tell me your name again, please.
My name is
Yes, sir. So for people like you who are visiting, right? So we have a member who has family here in Houston. She's from Nigeria, but she stays in Houston for about 5 months out of the year. So we give her a 1-year half price deal of $500 for the whole year. She has this whenever she needs us. So when she comes here to US, she can see us for our annual physicals, any problems that come, but if she's back home, we are still available to her through Skype.
I paid $1,800 for the medical insurance.
Yeah. You know, I think, again, insurance has its role, you know, for big things, but it's not for daily things.
Prevention versus reaction.
Well, I just add in, and this is just a 2 cents worth. The average age in here is over 30 years of age. Safe to say. What happens as we get older, we deal with a lot of chronic junk. Whether it's related to organs, whether it's related to aches and pains, and whether it's, you name it. Physical therapists can become a whole lot more helpful as we get older and deal with these things. One of the things that we know, it's very true with mental health, it's very true with all chronic conditions, is they're better managed when there is a consistent contact between whoever's helping you manage care and the person who's actually needing help. It's interesting, when telemedicine came out, they did countless studies, and pain was one of the easiest ones. They're like, okay, let's let people with chronic pain, telemedicine versus the doctor. Telemedicine managed it like 75% better on almost every day. Why? Because you didn't have to make an appointment, wait months to be seen, sit in the office all day long, be miserable. And that's why in the large parts, the chronic illnesses you deal with when we get older, blood pressure, you have these people wait 2.5 months to say, by the way, my blood pressure is 175. It's being able to have access, easy access, and touch base. It doesn't have to be a 45-minute conversation. Sometimes it's 15 seconds over the phone. So or an email that has your last 10 blood pressures. Well, yeah, we probably need to make a change, and we can do that. We don't need to see you when you have consistently, your blood pressure has been here over 10, 15 days. We can safely make a change. And those kind of things, when you're managing these things as we get older and we deal with them day in, day out, that makes this model a very, very effective model. And that's in a large part it. It's that ease, it's the relationship, it's that I don't have barriers. I know I could reach out and tell them that, and it may be tomorrow, but it'll get back to me, and we'll have a plan.
So you guys ready to sign up?
Yeah.
How easy is it to sign up? Very easy. We have no papers. It's all full of signatures.
That's
That's the beautiful part. Now we are free to do whatever we want to do. No third party, no regulations, it's very simple.
Only problem is we have one iPad, so.
Wait a while.
It's just very simple.
Well, thank you so much, everyone,
Thank you.
for joining us today.
Really appreciate it.
Very phenomenal.
I have a question. When is your next event?
Last
Thursday, but it may not be like.
What's the